Hey, this is Lawsuit Legal, and today we're going to talk about common infections with knee and hip replacement surgeries relating to the Bair Hugger warming system. First, we should discuss what exactly the Bair Hugger warming system is. The Bair Hugger warming system is a warming blanket used during surgery to help prevent hypothermia with patients during surgery. The system works similar to a forced air heating system in a house where warm air is sucked into a blanket and then is pushed out of vents that are on the other side. A patient whose body temperature drops 2 degrees Celsius during surgery is likely to lose twice as much blood as one who is kept warm, which is why they use the Bair Hugger warming system to help normalize body temperature. While the system works great for normalizing the body temperature, there are complications that can arise during use, including a reduction in resistance to surgical wound infection, decreased synthesis of collagen, protein wasting, increased intraoperative loss of blood and need for allogenic transfusion during elective primary hip arthroplasty, and metabolism of most drugs. On top of these complications, a randomized study found that a core temperature drop of 1.5 degrees Celsius tripled the likelihood of ventricular tachycardia and morbid cardiac events. Let's get into the product history. The FDA has a program called the 510(k) program. Under it, the FDA can clear a medical device without there being any clinical proof that it is safe, as long as it is similar enough to another device that is on the market and is medically cleared. In 1987, the first Bair Hugger warming system passed through this 510(k) program, and between 1990 and 2002, 12 additional clearances were passed through the 510(k) programs. From 2004 to 2006, 2 more clearances made it through the 510(k) program, and from 2011 through today, there have been several claims to the FDA about adverse events as a result of using the 510(k) cleared Bair Hugger system. What are some of the Bair Hugger's complaints? Court documents reveal one complaint from a 7-year-old man named Tommy Walton from Texas. Mr. Walton underwent the hip replacement surgery at a Houston orthopedic hospital, where afterward there was a deep joint infection that required 15 surgeries, including the removal of the artificial hip. Another complaint filed in Kansas federal court claims that the use of a heating blanket led to the spread of MRSA as an orthopedic procedure and eventually led to the amputation of the patient's leg. What legal grounds are there for a claim if you or a loved one have had any complications due to the use of a warming system after a hip or knee replacement surgery? Research from the Bone and Joint Journal found that warm air systems used during operations increase airborne contaminants by as much as 100-fold, with up to 2,000 times the airborne contaminants particles when used. The inventor of the Bair Hugger warming blanket, Dr. Scott D. Augustine, stated in a New York Times article, "I'm very proud of the old technology, but I am also proud to spread the word that there is a problem." The device manufacturer has pointed out more than 170 studies that suggest that forced air warming was beneficial when it came to maintaining a normal body pressure. However, Dr. Augustine argues that none of those studies properly analyzed forced air warming during orthopedic surgery. A CDC survey of healthcare-associated infections in U.S. hospitals revealed that 1 out of every 25 patients has a hospital-acquired infection at any given time. In 2011 alone, more than 722,000 patients contracted an infection while at the hospital, and about 75,000 of those patients died before being released. Attorney Gabriel A. Assad discussed the Bair Hugger infection litigation and had this to say: "The hip or knee replacement joint is not necessarily contaminated immediately prior to being implanted. It is certainly possible that dirt particles can be disturbed and settle on the components themselves as they are laid out in the operating room awaiting installation, leading to an infection. Additionally, infections can occur when those particles find their way into the open surgical site during an operation. We suspect this latter situation is how most of these infections develop." 2 forced air warming infection studies were done by FAW Facts. A study by Sessler et al. Tested the air quality in laminar flow equipped operating rooms with a forced air warming device under 3 settings: device turned off, device delivering ambient air, and device delivering warm air. The study found that there was no deterioration in the air quality with the use of forced air warming blankets with ambient or warm air, as well as no induced upward draft or disruption in normal downward movement of sterile air. Another study by Wang et al. Was conducted on 16 consecutive patients undergoing aortic surgery with graft insertion. The study found a reduction in the bacterial count in their operating room air at completion of surgery performed with the use of forced air warming systems. So is there a clear answer in whether or not the Bair Hugger warming system is putting patients at risk? A guest editorial written by Paul N. Austin, CRNA and PhD for the American Association of Nurse Anesthesiologists has called for a more definitive study including randomized controlled trials with appropriate blinding in order to determine whether or not the warming system is putting patients at risk. Compelling evidence has been brought forward on both sides, and the issue absolutely warrants a definitive study on any and all possible complications that could arise with the use of a forced air warming system, as well as joint infection rates. One point for further studies is to report that air currents produced by forced air warming systems could foster the flow of dust particles possibly containing bacteria towards the surgical site, leading to issues including the possibility of deep joint infections. Deep joint infections can occur post-replacement surgeries and can remain dormant with no symptoms for months following the procedure, leading to intense pain, loss of mobility in the affected joints, and even require revision surgeries and possible removal of the transplant. Deep joint infections can also lead to implant revision surgery, severe mobility and functionality issues, amputation, permanent disability, hospitalization, and even death. Current Bair Hugger lawsuits are aimed at seeking damages and financial recovery for medical expenses, pain and suffering, lost wages, and punitive damages. Patients who suffered hip or knee infections have a right to their day in court. If the Bair Hugger forced air warming system is found to be the proximate cause of their injury, they deserve compensation.